Good afternoon, everyone. This is Ellen Cadwell. I am Director of Health Informatics and Information Management here at Shoreline Community College. And today I'm going to give a presentation, an information session about our program, and hopefully you will get enough information that you will sign up and join us. But to start off, again, I'm Ellen Cadwell, and the second full-time instructor, faculty member is Gloria Anderson. We have two programs here at Shoreline for health information management. The first one is Health Information Technology, and upon completion of that program, you will have an associate degree and able to move on if you decide to a four-year school. You would be able to sit for your RHIA certification. Our second program is our Medical Coding and Reimbursement Specialist, and this is a 5-quarter program where you do earn a certificate, but not necessarily a degree. We have found that the majority of our students go through the coding program and then pick up the extra credits to have their associate degree. They're more employable that way. Our program is completely online, including our prerequisites. And our application process begins in January of each year and goes through usually April 15th. So that would allow you to start in the fall of this next year would be 2015. Our program are all accredited through the American Health Information Management Association. See, I'm trying hard not to use acronyms today. And our first one is the coding program, the Medical Coding Reimbursement Specialist Program. It is the only approved coding program in the state of Washington, and actually in a 3-state area, Oregon, Washington, and Idaho. And it's one of 26 approved programs in the country. So we are very proud of our work we do in coding. Our second program, the associate degree, the Health Information Technology program, is approved through an arm of American Health Information Management Association, or RHIA, and that's through the Commission on Accreditation of Health Informatics and Information Education. Here in Washington, there are 3 programs that are approved through the CAHIM, and they are Tacoma, Spokane, and Shoreline. Both Tacoma and Shoreline are online, and we do have students throughout the United States. We actually have students who go on vacation in Europe or the Philippines, and they're still able to do their schoolwork. Okay, what do we specialize in? We collect, maintain, analyze, and release data, medical data, that's been created by healthcare providers. Traditionally, we think of the medical record, if you're in the hospital or at your physician office. But the record is used to provide quality care, and it documents the care you got. So you be sure to keep your information, make your own little folder. It's nice to have that. We do record analysis, make sure the record is complete. Sometimes the physician just doesn't document his surgery. You have to chase him around the block a little bit. We do that. That was always one of my favorite chores. We release information to patients, other facilities, insurance companies, lawyers. Your information goes a lot of places. We also help create statistics. And if you go through the HIT program, the associate degree, you will be taking a statistics course just on health information. How many patients had complications post-surgery? How many babies were born? And this is how people make their decisions on whether we need another site or another ward. We have registries, and people don't think about that, but a lot of people collect your information. So there are birth registries that are created, and your baby gets a birth certificate. There are death registries, cancer registries, abuse. Yeah, it's all collected, and that's where all these great stats come from us. We also do the coding for diagnosis and procedures. That's how a hospital gets paid, and they're also able to track information that way. So if we take pneumonia, that doesn't mean anything, but if we codify it, it can be used actually around the world. And so the code would be, simple one is 486 for pneumonia, but everybody would know what that meant. We assist in the systems for reimbursement of patient care. As I said, it all kind of folds together, and that's from the medical record. And we're spending more and more time working outside of the Health Information Management Department and becoming an integral member of the administrative teams of facilities. Where do we work? Well, we work everywhere. It's amazing places people are getting jobs. So we normally think of hospitals, physician offices, and clinics. But the long-term care facilities, the skilled facilities, they are starting to hire more professionals, the RHIT. They know the billing, the systems, records are becoming computerized. So traditionally, you would go into a long-term care facility, and the lady who was answering the phone at the front desk was also in charge of the record. And this is definitely changing. We work in home health, in hospice care, law offices. We send all this information to lawyers, but someone still needs to be able to compile it, find it, make sure it's all complete. Otherwise, it would just be a big room of probably loose files. So it's very organized. Insurance companies, they want to make sure they pay for what you get. And so they're always doing reviews of the records and finding possibly overcharges. We work in government agencies, the prisons. They all have healthcare facilities, centers for disease control. That's actually was my first job. I went around the country and collected data, and from there we created the first infection control manual. Still in use today. Workers' compensation. And usually somebody that's been in the field a while, there's software companies, 3M, Quantum, all the programs, they get used, and it's nice for someone like me to talk to another healthcare professional, health information management, because we're going to be speaking the same language. They're great jobs, but you better be a road warrior. There's a sample of job titles for health information technology and medical coding reimbursement specialist. This is not all inclusive, but there's so many titles now, and they're growing. We had an advisory meeting here just in November, and it was very interesting. The group from the hospitals here in Seattle were talking, and they had more job titles I had never even heard of. And so, our roles are changing and becoming more specialized. Credentials. You'll find out that people in health information, or really in any field, just love to have credentials after their name. And we have students who actually take the beginning exam for coding just so they can have that CCA after their name. But the credentials do come. The first one is the Registered Health Information Administrator. This requires at least a 4-year degree, and many of us have 6 years just because picking up all the prerequisites to start your courses. And both Gloria Anderson and I are RHIAs. It's a bachelor's degree, and you have to graduate from a CAHIM accredited Health Information Administrator program. Here in the state of Washington, we have the University of Washington and WGU, Western Governors University, and they are both approved by CAHIM. Then you have to sit for the certification exam. I think it takes about 2 hours, and I'm glad I just don't have to do it again. Too much information. We cover everything. Then there's the RHIA certification, and that's what our program here is at Shoreline. You need an associate's degree from a CAHIM-approved school. Graduation, again, I had said before, it's Shoreline, Tacoma, and Spokane. And Tacoma and Shoreline are both online. And then you have to sit for the RHIA exam. And the credentials keep coming. We have the CCA, the Certified Coding Assistant examination that you can sit for. You do not have to have a college degree for any of the coding certificates if you know how to code, and you can sit for any of these exams without a degree. And the CCA, I don't recommend it for most of our students because you have the coding certificate, which is actually a higher level than the CCA. But as I said earlier, some people just want a credential after their name. The CCS is a certified coding specialist. Most people take this exam a year, 2 years after they begin working as a reimbursement specialist. Now, I'm noticing here it says 1 to 4 years, but I think most people do it usually in 2. We've even had a couple of students sit for this exam while they are still in school. And the next one is a certified coding specialist, physician, and these people do specialize in clinics, and evaluation and management coding, and we recommend, if that's where you're going, is to sit for that exam if you're working in clinics. And then there's a certified professional coder, and this is it's outpatient coding, and you can get your training online at the American Association of Professional Coders, AAPC. So this is not connected to the school. It's not approved by CAHIM. It is not college credit, but we do recognize it as a valid coding credential. Now, everybody's always asking me, how much money am I going to make? I'm tired of not making money. I need to be able to support my family. So I'm actually right now gathering information on pay here in the Puget Sound area, and many coders start at $19 an hour. And I got one feedback yesterday, and I can't imagine it's not right, but they said $60 an hour. If so, I'm applying. So it was a $40 span, so it started at 20 and went to 60. I'll find out if they're hiring. Every hospital's different, every clinic's different. Hospitals traditionally pay more, but here again, in the Puget Sound region, don't be disappointed if you start off at $17 an hour. To get information in your area, if you go to the Bureau of Labor Statistics, I have the URL listed here, www.bls.gov, and that'll give you an indication. This area does pay well. Different areas of the country, small towns, you're not going to get the same income, just like any other job. I'm going to spend a little bit of time going over our instructional content. We base our program on competencies that are put out by AHIMA and CAHIM. And so we're looking at the competencies you will need to work in hospitals, clinics, and other healthcare facilities. We work with paper-based and electronic health records. We have an emphasis on the collection, management, analysis, and presentation of health data. And there is a lot of extensive training in hospital inpatient and ambulatory care, coding, and reimbursement. So we are the money people. Everything goes through usually an HIM person to get paid. Our curriculum is based on general education. There are prerequisites for the school for you to graduate either with the certificate or the degree so that you can be competent when you go out in the world. We're not just a coding program. We actually give you a very well-rounded education. You're going to take classes in business and healthcare computer applications. There are the medical sciences. We do pathophysiology. I love that word. Pharmacology, human diseases. So again, it's a very broad education. The health record content and systems, you have to know how to read the record so that you know if it's complete or not. And that's actually a full 5-credit course. You're also going to be learning about long-term care, dentist office. I still have been asking the teacher for alternative records if she would go on with vet office, because we have had several students who actually become the records persons for some of these large veterinary clinics. We teach you how to do data collection and analysis of that information, quality improvement in healthcare. We're always on those teams. And the principles of management. That's one of the courses I teach for the second year, and I really enjoy the course. As I said earlier, we are 100% online, and we use a tool called Canvas. It is the background where all our classes are stored. And you can learn how to use that through the college when you start, and once you get used to it, it's fine. Your instructors are going to be available by phone, Skype, email, and in person on office hours. And for the in-person, that's normally going to be Gloria and I, because we are based at the school, and we try to spend at least 2 days a week here in the office for those students who wish to drop by. Skype, that's a fun tool. We use that quite a bit with our students, and I think probably the most common is email. That's where we seem to get most of our contact. The instruction itself in Canvas is going to be written documents, so there's a lot of printing to do if you decide to, you like paper rather than reading electronic information. We do Panepto recordings, and it's usually a PowerPoint presentation and then the instructor speaking. We do have slides with audios and lots of online activities. So your medical terminology is online. We have virtual labs, so you get hands-on practice. And what's nice here at Shoreline is your testing is done online. Some schools, even here, like if you're taking an online math class, you have to come to the campus to do your exam. Now, that might be fine for others, but if you live in Florida, that would be a pretty hefty hike. So, again, we do offer everything online. You can do it in the comfort of your own home. Assignments are sent in online, so we don't deal with a lot of paper. We do our grading right on the computer and can leave you notes, suggestions, and you get a sense, you know that we have read your work and graded it. And one of our instructors especially likes to use Illuminate. She has a coffee session, she calls it Coding Cafe, that is on Wednesday evenings, and she tapes it. So you can call in. You get a group of 6-8 students, and they work together, going through problems and solving it. and she tapes it, and then it's available to everyone. Now, like anything, if you were in a regular classroom, you'd be having labs, but we do have hands-on practice. So there are a lot of projects. We're very project-based in our program, and especially quality management, quality improvement, your capstone project, alternative records. We even, in our legal course, have you go out and go to a courtroom, sit through a trial, know what's going on there, and you report back on that. So you do get a chance to get out and get hands-on. We have online health records. So they're computerized, and we have a mix. We've got some that you can't read the handwriting, just like in real life, but others are, so they've been digitized. And then we have the true electronic record, and that is our near perfect electronic medical record. It's new to us in 2014-2015 school year, and we are expanding the use of that program throughout more and more of our classes, because the electronic record is here to stay, and it's nice to know that just basic how to use it. And then we have clinical practice for health information technology, and that's called our professional practice experience. And students do go out. I would like to have it longer, but facilities usually will take students for 2 to 3 weeks. And other than that, we do, I call them virtual projects. So I will have labs available to you through that program. And but mostly people go to hospitals. I do have several students this year that are at chiropractic offices, and we have had students at veterinary offices. We've got another with a dentist this year. So where there's a medical record, we can go. When you apply to our program, we request that you have your prerequisites finished. And the program prerequisites are Biology 170, which is human biology. It does not have a lab. Some students come and they've taken 1 or 2 courses in anatomy and physiology. And depending on the school and how those courses were set up, we will accept those. Math 98, Intermediate Algebra 1. Don't let it scare you, folks. It's basically beginning algebra, and this past year, they changed the course number to Math 098 Intermediate. It's the same course as beginning algebra. So if you've had that somewhere else, that it will transfer in. English composition 101. If you have a degree in college, you probably have already taken this, but if not, get it in, because you will be doing a lot of writing. If you've not taken college level math or English, you need to take the Compass test, and that will place you in hopefully English 101, and then you can take the course. But all colleges now require some type of placement test, so they make sure you're not overwhelmed. And computer literacy. So you should know how to use Word and the internet. I did have a student several years ago who was starting the program. Again, we're online. She didn't own a computer, and she didn't know how to use a computer. So we had her take a course in how to use the computer. Okay, how do you get started? It always seems to be the hard road. Each year, between January and usually mid-April, we are accepting applications. So the school year within the formal school year would start the next fall. And our application is available online, and you can print it and then fill it out and submit it to our program secretary, and she will make sure your advisor gets that. Before you start, if you've not been a Shoreline student before, you will need a Shoreline student ID. And there's no application fee. For this, you just need to get online and fill out their form, and they will send you the student ID. With the application to the program itself, we do require one official transcript from each school you want us to review the courses you've taken. So that if you took Math 80 and beginning algebra at South Seattle, I would need a South Seattle official transcript. For the math and English, if you are just placing into beginning the math class, the English class, please submit the results of your Compass test. So if you apply in January, I can tell you that in spring, you need to take this prerequisite. And we would accept you into the program if you could complete it successfully. And so it's like a temporary. So don't let that throw you off. We'll do our best to get you with us. And then a $15 application fee. And it should be with the application and a check or money order. So now you've got your application in. Again, my name is Ellen Cadwell, and I work with the students A through L. If your last name begins A through L, you're mine. Gloria Anderson, the other full-time faculty member, she handles students whose last name begin with M through Z. If you're having trouble, contact whoever you can. We will help you. It takes about a month to get your application through. It comes to us, and I then, or Gloria, we review the applications. I sign off on all of them, and then we'll write up a curriculum plan for you, what courses you're going to be taking. And I get that information of what program you want to be in, whether you're going to be full-time, part-time, and each student, their curriculum plan is designed for them. And eventually, you will be getting a letter from our program secretary that you've been accepted or that you need to complete English, math, whatever in the spring. I would recommend that you continue to check our program website at www.shoreline.edu/HIIM. We periodically do have updates on there, and the information, we keep it very current. Thanks to our IT people, Public Information Office. They do a great job for us. Okay, now it's January or February, and it's so long before school starts in the fall, and you want to get going. You might have your financial aid. So there are things you can be doing before fall. Of course, if you need to pick up the prerequisites, there's human biology, English, math. That's that computer applications program. Again, you probably do not need it if you're watching this video. I know you're on the internet. Medical terminology. This is a great course to take anytime. So you take it, it's offered 4 times a year. So that's just one less you'll have to worry about in the fall. We do have a survey of healthcare delivery. This is offered in the fall, and you would need permission. So you would contact your advisor, and you'd be put on a wait list. So people that are actually in the program, actively in the program, we give them first chance. But if we have extra seats, we're certainly going to let you take that course. The fun courses. There's that. If you're going for the associate degree, there's Access and Excel. And for the medical coding degree, you can also pick up Human Relations. Lots of courses here. With the associate's degree, you are going to need the Multicultural Issues course, and there's a 5-credit course and a 3-credit course. Again, if there's room, we have Pharmacology that's offered in the fall and spring. You can be taking that, fall and winter. And then Human Diseases. and that is offered in the winter too. But anything that says needs permission, it's a wait list. But we usually get most of our students in that want to do it. And then let's look at the technology. I know as a student, it's hard sometimes to be able to afford, the newest computer, but it is an investment in your future. So a newer PC really helps. I don't know about yours, but the one I had at home, it was only 4 years old, but it kept bogging down and things were slow to load. And all I did was change up the box and, away I went again. Good screen resolution. Don't try to do your homework on a little tablet, a handheld device. I had a student who was constantly complaining that she couldn't see the whole page, when I was talking or reading. So she was having difficulty. Then I found out she was getting online, trying to use a handheld device. High-speed internet access. You want cable or DSL. Do not try dial-up. I think there are still areas of the country that probably do use dial-up, but it's not recommended. It takes too long. Your browsers. Our programs use a lot of different browsers. I actually use all of these, Chrome, Internet Explorer, and Firefox, because I've found that different programs work better with different browsers. So go ahead and get them. And then your latest versions of Windows, that can be obtained at a very good price, if not free, here at the school. And I know it's free for faculty, so be sure to use something newer. And you do not need to download a lot of this, but Canvas, Illuminate, and Panopto, those all need you dial in, or when you get on Canvas, they will be available to you through the VPN. And you're going to want to have Skype. I have one teacher who insists that all her students have Skype. I use it quite a bit, mostly talk to other teachers, but again, students like to use it too. You're going to want good firewalls and virus detectors, paper and toner. Again, everything's online, but I'm a hard copy person myself. And for more information on that, if you go to the Shoreline .edu website, there is more information on what technology you would need. And that concludes my presentation. It's been a pleasure visiting with you today, even though we are doing it virtually. And I look forward to meeting you via email, in person, whatever. And Gloria and I, hopefully, will welcome you to our programs. Thank you.